And go ahead and admit. Hello, hello. Thank you all for joining today's information session titled Intersection of Climate and Health, Integrating Ahtna Values and Community Priorities into Health Assessments. In this session, we will explore how communities in the Copper River region are incorporating Ahtna values and community priorities into health assessments. Presenters will share the origins of the project, how the collaboration has evolved, the frameworks used to understand links between climate and health, and finally, methods to develop a practical health assessment tool. I just want to acknowledge before we begin that everywhere that we live and work is on Indigenous land. Our offices are located on the traditional territory of the Lower Tanana Dene people on the Trathyada campus, or otherwise known as Potato Ridge. We also have team members who are joining us from their traditional homelands of Shaktoolik and Quinnipiac. And I just want to share here our team members here. We have a few folks who will be joining us today, but all of the work we do is a collective effort here. I also just want to share a few Zoom reminders. This meeting is being recorded. And hopefully you all are being muted as you come in. If not, please go ahead and hit your mute button. If you are calling in by the phone and you don't have a designated mute button, you can go ahead and hit *6. And just a little bit about our the Alaska Tribal Resilience Learning Network. There's a few different ways that you can engage with us. One is just via one-on-one check-in calls, providing technical assistance. You're always welcome to reach out to us. We also have our monthly e-newsletter, which we try to consolidate a lot of things that are happening throughout the state related to climate change adaptation. And finally, joining information sessions like this one today. And next, just a couple of quick announcements. We do have our session for next month already scheduled on April 23rd. And this is going to focus on creating resilience through harvest to home and the Alaska lumber grading program. We also have a few spots left for our upcoming training in April called Climate Information for Adaptation Planning. And with that, I would like to go ahead and welcome both Colleen Merrick and Dr. Micah Hahn, who will be presenting today. Colleen Merrick is the Department Supervisor for Tribal Community Services at Copper River Native Association. She has a background in human health, biology, and fisheries, and she is living and leading climate adaptation efforts in South Central Alaska. Colleen employs her diverse skill set to organize and manage adaptation strategies for those living on the front lines of climate change. Dr. Micah Hahn is an associate professor of environmental health at the Institute for Circumpolar Health Studies at UAA. Her research explores the health impacts of climate change and helps communities develop effective, locally tailored strategies for adaptation and resilience. With a background in environmental epidemiology, Dr. Hahn combines epidemiological techniques, spatio-temporal exposure analysis, climate environmental data, and mixed methods approaches to her research. We are very excited to have them both here today to share a little bit about their work. And with that, I am going to go ahead and pass it over to Colleen and Micah.
Everyone. Okay, first step, let me see if I can share my screen with y'all. It looks like, all right, tell me how this looks for you guys. Does that look great?
Yep.
Nice. Okay, step one. All right, well, thank you guys so much for joining us for this lunchtime webinar session. We have a lot to share with you, but we also are really excited to have some conversation at the end and hear, where you think this might be something that you could apply in your communities, or what this makes you, what this makes you think about. She's already introduced myself and Colleen. I just want to acknowledge up front that there are very many contributors to the work that we're showing you today. I'll let Colleen present her, share her colleagues in the Copper River. But before we get there, I just wanted to give you a little bit of an overview. Krista kind of already laid out the agenda for what we're hoping to cover today. But we want to do this in sort of like a dialogue format where I share something, Colleen shares something, and we'll kind of go back and forth. So you'll see us flipping between our speaker screens. But we'll kick it off with Colleen talking a little bit about how this collaboration evolved from her perspective. And then I can tell you a little bit about the sort of the researcher side of things. We wanted to share a little bit about sort of traditional frameworks for thinking about climate and health, and then hopefully it'll become very apparent why maybe some of the limitations of those frameworks and why what we're doing kind of fills that gap. And then we'll give you a little bit of an overview of this methodology or this framework that we've been working with, and Colleen will tell you in more detail how they've applied it in the Copper River region. And then we thought we would just finish up by talking a little bit about our perspectives of now having gone through this together and with our broader project team, like what are some things that we thought were really powerful strengths of this approach, and I think that will probably naturally lead into some conversation with you guys. Do you have anything you want to add to that, Colleen, before we introduce the team?
No problem.
Okay, I'll kick it to you to present our broader group of folks.
Great. Thanks, Micah, and thank you everyone for having us here today. We're really excited to share a little bit about this work and how it's impacting the Ahtna region. So again, my name is Colleen Merrick. I work to support all of our programming here in Tribal Community Services under Copper River Native Association. So we're in South Central Interior Alaska on Ahtna lands. So who are we? Copper River Native Association is a regional tribal health organization, and we provide various services to our compacted tribes as well as to the greater region. And so that basically started this project for me, is that I was supporting Native Village of Gakona, specifically Lishaw Lincoln, the environmental coordinator, and Derrick Sinyon, the environmental manager up there in their work. And they came and said, hey, we've got this great project going with Micah and UAA to discuss how we might be impacted by wildfire, by the smoke and the poor air quality, as well as actual fire coming to our region. And so Lishaw and Derrick and I showed up at a couple of the first meetings with Micah, and we didn't really know what we were doing. We didn't exactly know why we were there, but we knew that we were there to start a relationship, and we knew that the end goal was to better our community and our understanding about how wildfire might impact us in the long term. So yeah, that's kind of where we started this journey.
Awesome. Yeah, thanks, Colleen. So yeah, on our side of on the university side, I'm at UAA, as Krista mentioned, and there are 3 research professionals in my group who have been supporting this work. Particularly Mohammed Khan has been working closely with Copper River and analyzing the data and sort of helping us think through how to visualize it. And then I also wanted to mention Jamie Donatuto is someone we've been working with on this project. The concept that we're going to share with you is something that she's developed over a really long time in her collaborative work with the Swinomish tribe down in Washington. So it's been applied in lots of contexts, and so it's kind of cool to bring it up to Alaska and think about how it might work here. Okay, so Colleen talked a little bit about how the project evolved from sort of the partner side, I guess, if we're thinking about, this is a funded research project. And so from the research side of things, we had funding. And basically, the bigger project goal was to reduce the negative health impacts from exposure to climate hazards by providing access to data. That was kind of like the sort of the goal of the RFP and like what we set out to do. We knew that we wanted to do this through developing some kind of online web tool. And we, as Colleen mentioned, we focused in on wildfire smoke. Again, that was part of sort of the broader goal of the funders. And we wanted to think about wildfire smoke in the context of other social determinants of health. And while, so that's part of our project, and while the tools that we've put together are a vast improvement in terms of improving data availability at the community level on these topics, we knew that from the outset that we could put all the data we want into this online tool, and it still wouldn't really fully capture the social, cultural, or community dimensions of health that we know are really central to Indigenous views on health. And so at the outset, we knew we wanted to have another component of the project, which is what we're going to talk about today. So we have this, a big component of the project is basically around community-driven indicators of Indigenous health and thinking about how those health indicators can be applied in the context of climate adaptation planning, specifically in this case related to wildfire smoke. But the cool thing about the framework that I hope you'll leave with today is how flexible it is and how it's something that you could apply to lots of different parts of your work in your communities. And sort of a key of this project is that we have a large project team. So, it sort of started at the university because that's where the funding came from. So in the top left-hand corner are like the sort of the traditional players, right? In terms of the academics, the professors and graduate students and research professionals. But really the key to all aspects of this project have been the other folks on the project team, basically everyone else who are practitioners. So we worked with folks from the state and local health departments, from someone from the Alaska Fire Science Consortium, and then a whole host of people from rural communities across Alaska, a lot of IGAP officers, but also folks like Colleen that are in more regional positions. Okay, so now we'll sort of get into like the frameworks and thinking about how do we measure health? How do we think about frameworks of connecting climate and health? So we thought we would start with talking a little bit about what we mean by health indicators. So sort of the traditional view of health indicators these are quantifiable measurements used to measure the health of an individual or a population. So right, when you go to the doctor, you step on that scale, they take your weight. They put on the blood pressure cuff and they take your blood pressure. Maybe they look at your glucose. These are all health indicators, and there are ways that we can set health goals for ourselves. You're trying to hit that certain weight. You want to keep your blood pressure at a certain level. And, it's also used as a way to define someone as healthy or unhealthy, right? A disease diagnosis would be another traditional sort of conventional biomedical health indicator. Another example of this is that these indicators can also be scaled to sort of a population level. So maybe one example of this that you might be familiar with in Alaska are our Healthy Alaskan goals. So these are goals that are set on a 10-year time scale, and these are population health goals that we're trying to hit for Alaskans. And so it looks at things like cancer mortality, smoking and drinking, prevalence of obesity, deaths from injuries, mental health. And so it's really important to be very thoughtful about the indicators that we're using, because these indicators are used to allocate public health resources. They're used to plan health programs because we're saying this is something we're concerned about. So we're going to put our energy towards trying to improve this health indicator. It's, I think, sort of like a short way to think about it is like what we measure is what we know. And so it's really important to think about like what are those things that we want to measure, because that's going to be a sort of a facilitator or a driver of where we're putting our effort. And so when we now try to connect indicators or health indicators to climate, like this is often a framework that people will start with. And this is sort of a way to think about like the myriad of effects of climate change on health. And it looks like it's super inclusive. Like there's all kinds of stuff on here. Everything from, direct impacts of extreme heat and wildfire smoke, to changes in vector-borne disease, even changes in living conditions, health inequities, food system impacts. But I'll say that very quickly in my work in climate and health in Alaska, this is sort of my training. This is where I came from as an environmental epidemiologist. It became very clear to me that when I start to have conversations with people about climate and health in Alaska, these aren't often the things that come up immediately. Often, especially in rural communities and indigenous communities, people start with talking about impacts on traditional food sources or impacts on their ability to do cultural activities. And I was like, wait, that doesn't fit in this framework. But like, that's totally a health impact. Like, how do we merge this together? How can we make the way our frameworks and the way that we're like thinking about these issues actually meet people where they are on the ground and reflect the realities of what people are talking about in communities. And here I will kick it over to Colleen after I sort of like give you the academic perspective on these things. So, like, all right, now let's shift a little bit and say, all right, what are sort of the like academic ways that we've tried to think about Indigenous perspectives on health and put them into frameworks? The photo on the left is actually from the National Climate Assessment. And, it's an art piece that it's called Indigenous Holistic Worldview. And it's meant to sort of demonstrate the interconnections between human social systems and the environment, connections to social justice, connections, and how that relates to environmental change. And then on the right is sort of it's an Indigenous health framework, but the important things to take away there are that unlike traditional biomedical views of health, where you look at, things like disease diagnosis and blood pressure, Indigenous perspectives on health often include not only physical and mental health, but social, cultural, spiritual well-being, and really emphasizes the interdependence on individuals and also their broader communities and the broader natural environment. So how can we take these ideas and put them into sort of the language that has validity and like meets the standards sort of biomedical health? So yeah, I'm kind of curious, Colleen, if you have anything to add on sort of this conversation.
Yeah, I have always lots to add.
Yeah.
So working with Micah and her team, along with Lishaw and Derrick, we kind of got to this point in the project where we're looking at metrics that the CDC puts out, that NIH puts out, that Micah has just talked about. And we kind of asked ourselves and started looking at ourselves and said, are these the only ways that we can measure health? Is this the only metric system that we have to determine if our community is healthy or not? And really what it came down to is no. And so this is where I really think that the research project took kind of a turn, almost a tangent, but a parallel tangent. And I think that this was great, not only for our community, but possibly for the research team as well, where we were able to start taking this kind of co-stewardship model for production of knowledge. We were able to kind of change the perspective of how we look at health, decolonialize the process. And as Micah said, we're looking at it in a more of a holistic way. So this kind of collage of photos from our region is important because when we look at the photos, we don't instantly think these are photos of health. But when we look at our Ahtna values, our traditional values, we can see that there are things in here happening, that respect for the land and knowledge is happening with the little kids learning about the berries, that sharing of produce and knowledge is happening with the production of the community garden and handing out of food, that family and elders and knowledge all come into play when we go to fish camp and we learn about the process of gaining and preserving food, not only for ourselves, but the community beyond. And so, yeah, these are beautiful pictures, but this is how we quantify our health. There are metrics that we can use, and Micah and her team were really great at this point because we were able to implement our own values and quantify our health based on them. And so these words here are not just words, these are our values. And through this process, we were able to say to the world, to researchers, to Western science, and to our own community that we can measure our own health, and this is how we're going to do it. Thanks, Micah.
Mhm.
Okay, so now we'll sort of shift into talking about Indigenous indicators of health and sort of the framework that we're using. And so, we were trying to think about like, in retrospect, Indigenous health indicators are sometimes kind of hard to sort of define at the outset. It's like you almost need to experience the process, and then it becomes clear on the backside. And so we'll get to sort of the example of how this has been implemented in the Copper River region, and you might get a little bit more of a tangible feel for it. But that said, we wanted to start with some definitions to get us sort of on the same page. So I think about these indicators of Indigenous health as being sort of like a bridge between Indigenous perspectives of health and well-being and those conventional biomedical health indicators. I said something that you can quantify, something that you can measure, something that you can see change in, something that you can put in a graphic. Like these are a lot of times the values that people talk about are really hard to sort of like wrap your head around, because it's just who you are. It's a feeling. This is how we operate as a community. So how do we kind of bridge that gap? And it's really a framework. It's a way of thinking and a way of conducting a more comprehensive health assessment that really incorporates Indigenous perspectives. Colleen, do you have anything you want to share on this one?
I think that was comprehensive and I agree.
Okay. Okay. And here, yeah, we're really curious to hear Colleen's. I'll give you the academic, like, why would you want to use these? But I'm curious to hear from her also, like, some of the things that she's seen. But basically, for me, if I were trying to explain this to like another community or like another researcher or someone who was trying to facilitate something, the thing that I like about it is that it's a very practical way to do some things that are really hard, which are like have really, facilitate community dialogue. Like that's a whole thing in itself. And these are really complex, like multifaceted issues when you're thinking about environmental change, but also like impacts on individual level, on the community level. So it can really help facilitate that process. It ensures Indigenous voices are prioritized in health assessments. Like it's really, you're starting from the ground up. Like what do people value? And then that's what you then use to be able to like assess the impact of various programs or environmental like exposures, that type of thing. On the front end, I said something like, what we measure is what we know. Again, if you are sort of like focusing on these indicators or these values, you will build, and it gives you a way to build adaptation strategies or programs that are directly supporting these values. So you start with the thing that's important, and then you kind of like build everything else around it. And something I feel like actually this one I thought of, Colleen, after thinking about some of the conversations we had about advocacy around subsistence food resources and that kind of thing in the Alaska context. It can really be a powerful advocacy tool because it's something that kind of, when you talk about health, it like resonates with people in a way that sometimes, regardless of culture, everyone cares about health of the individual and health of the community and health of the family. And so it can kind of like bring some of the Indigenous values up to like an even playing field in some ways with people outside of the community that you're trying to communicate with.
Yeah, you're so eloquent, Micah. You nailed it. I would just like to point out on this slide, we've got a really beautiful picture of Eva Burke. She is an amazing advocate for food sovereignty. And this was an event last summer where we were able to collaborate with Intertribal Agriculture Council and bring youth from our region up to the Nenana Fish Camp for their youth summit. And again, this is just another example of an event or a process or an activity that increases our health, and using these Indigenous health indicators, we can actually provide metrics of how much healthier we might be when we share this traditional knowledge and these processes with youth and have this amazing intergenerational knowledge exchange.
And Colleen, I can't remember if you know exactly where this quote came from. I think it was maybe Lishaw.
Yeah, I think this was Lishaw. So Lishaw Lincoln, native village of Gakona. I believe she's a tribal member of Clutica. And I think she was just trying to express how these IHIs, these Indigenous health indicators, really help us quantify the way that we are already thinking. We're thinking holistically, we're thinking with values, we're thinking with heart, and that having this research tool that Micah and her team have provided is a way for our voice to really be heard on a broader audience, to a Western or research focused audience, and express what we know, but maybe they need this process and they need it in a certain way, to understand and validate what we're saying.
Okay. So we'll now sort of shift into like, I'll give you just a brief overview of the Indigenous Health Indicators process. And then I'll throw it over to Colleen and she'll tell you a bit about their work in Copper River region. So first thing, you'll see the process is in quotes. That is intentional. I think it's very, at least, I don't know, I'll speak on behalf of me. When I'm learning to do something new, I want someone to break it down for me. I'm like, okay, what do I do first? What do I do next? What do I do next? And you really want like it's comfortable for me to be able to sort of follow a stepwise linear process. And so as a teaching tool, I've sort of put it here in the way that I learned about it and the way that we've sort of implemented it briefly and or we've implemented it somewhat in Copper River. But I will just say from the outset that just as every community has a unique set of values and priorities, similarly, the process of defining the indicators and how you go about doing that will vary greatly from community to community. So what this tool offers is not a like step-by-step, this is how you should do it. Again, it's more of a framework and a way of thinking about something. And then it's up to the community facilitator to collectively decide like how you want to get from point A to point B. That said, as a teaching guide, sort of these 5 steps are kind of like a useful starting point for thinking about how you might facilitate this dialogue in your own community. So basically, at the beginning, the outset, it's important to define those indicators, like what are our health values in our community? And then, we'll think about this. Let's use climate change and climate adaptation as our frame, because that's probably what most of you guys are thinking about. But again, this is something that can be applied to lots of different aspects of community building. So we have our indicators, and then you may have like a specific issue of concern. In this case, we were thinking about wildfires and wildfire smoke. So of these values, which are going to be most impacted by wildfire smoke or whatever it is, that new, the dam project that's going in, or that other industrial thing, or, coastal erosion, or whatever impact it is that you're concerned about. Once you sort of say like, okay, these are the issues that are going to be impacted, of course we want to work on everything simultaneously. You want to support all of these health indicators, but knowing that there are limited time, limited funding, limited human capacity, what do we want to focus on first? And I think this is often I think that this is often one of the more challenging conversations to have with communities, because no one wants to like rank one value higher than the other. So it's important to remember, like, it's not that we don't think these are important, it's that we're trying to figure out where we want to focus our efforts at the beginning. And then that's when you start moving into adaptation strategies and thinking about here sort of the world of possibilities. Here are different ways that we could address this issue. And then again, sort of a ranking process where you're thinking about what solutions you want to focus on first. So I'm going to pass it to Colleen, and you will see that very quickly this process kind of got like, some of these steps are merged and some of these are moved. And so we've broken it down a little bit by the step in the process, but you can see how flexible it is through the work that they've done in Copper River.
Micah.
Okay. Yeah.
Great. So just to orient ourselves again, South Central Interior Alaska, these are Ahtna lands. Copper River Native Association directly supports 6 of our compacted tribes, including Cantwell, which is outside of our direct watershed, but is still very important and part of our Ahtna community. We do support additional community members outside of those compacted tribes. So that is where we are located. And then this is where our project started. So just being that I'm in healthcare, I'm going to just kind of bring it back to how Micah originally said. We're thinking about metrics and the way that we're going to measure ourselves in a very like kind of siloed way. And so just even for myself, this was kind of a novel concept of how we are going to apply values to our health. And Jackie Schaefer says this all the time from ANTHC, is that we need to put on our different glasses and we need to change our perspective when we're thinking about health. So the first thing we did was we went ahead and aligned ourselves with our annual health fairs, which our wellness department organizes at each of our compacted tribes. And so it was really great that we already had these events going. We didn't have to do a lot of organization, but Lishaw and Derrick and I showed up at each of these events to start collecting data about how people felt about their health and how they felt that their Indigenous values, their Ahtna values, were going to impact their health. And this occurred basically from April till June of 2024. Boom, thanks. Next step is that we rounded up these Ahtna values. They had been in existence for a long time. CRNA operates based on these Ahtna values. You find them in all of the directors' offices. We just kind of, jazzed it up a little bit just to kind of grab people's attention. The big piece here, respect. Knowledge. Are you trustworthy? Are you caring? Do you share? How is your spirituality and how is your honesty? And again, these do portray health, but you have to have on the right glasses and you have to have the right discussion and be with the right people to really, truly understand and validate this information. So those are our values. And then this next slide is a great example of how we accomplish this. So this is at our environmental fair. We have Mike DeLue along with Derrick there giving the presentation to a couple of community members. And this is the story that we tell. Hey, we've got all of our Ahtna values here on this beautiful poster. Part one is, which one of these values most impact your health? And sometimes you say this a couple of different ways so that people start thinking, if you didn't have a healthy environment, do you feel like you would still be healthy? And you kind of are just probing. Each community member that participated was given 5 colored dots, and they are able to vote with those dots in which category or which value they feel like most impacts them. And I guess I would just mention at this point that based on their demographics, we gave them different colored dots. That's why this looks so fun and bright. And so we were able to pull out of this information how maybe youth might be thinking differently than elders versus the average age community members. We did also pull out any non-native views from this information. So this was the beginning of collection of that data. And this is what it looks like. And maybe I'll just really quickly, and then Micah can jump in, is that we, over the course of our 6 health fairs and our environmental fair, which targeted kind of that youth and school age population, it really came clear very quickly that respect and knowledge are our 2 most valued values that impact our health. And this is a really great visual that resonated with our community. And to see if Mike has anything else to say about this.
Sure. Yeah. The only other thing that I will say here is that these data are sort of the raw counts of all of the votes. And remember, so there are 679 votes, but everyone got 5 dots. So you can do the math and decide how many individuals voted. But this is the total votes across all 6 of the community health events. And so in chatting, about how we want to do analysis and how we wanted to present the results, we wanted to not only look at the raw votes, but we also wanted to do analysis where we could sort of give equal weight to each community. And so, if it was a tiny community and only had a few number of people show up, like how do they weigh into these results versus if it was a large gathering and a lot of people voted. And so we also looked at these results in one other way, which was to do these sort of an average ranking of the results. So this basically gave a vote to we looked at the rankings across the communities and then averaged those rankings together to sort of see what what this looks like when it was weighted by community, essentially. And in this case, the same, it looks very similar. Respect and knowledge sort of came out on top, but it's just another way of analyzing these data.
Agree.
Yeah.
So then part 2 of our story with our community members was, okay, now you voted with your 5 dots on which of our values most impact your health. Now we're going to tell another story, and we show our region. We've got this beautiful laminated map so people can orient themselves, and we say to them, now imagine there's a wildfire. And we can point to the map close to your village, close to your home, and it's raging through, and maybe it's burning your berry patches, maybe it's burning the area where you go out and hunt. Now, which of your values will most be affected? How is your health going to be changed when this wildfire and the poor air quality and your food and everything is affected? And so this was the second vote. Again, they got a different color so that we could delineate what is impacting your health and then how is your health impacted by wildfire. And the not surprising, respect and knowledge still remained our top. There were changes in some of the other pieces. I'll let Micah kind of highlight those. But we know that knowledge of our environment, or respect for our environment, respect for our food, family, and elders are still going to come out really high, as well as knowledge of tradition, land, and yourself. All of these things will be impacted by wildfire.
I will just add to that we did a similar ranked results for wildfire. I'll show you some side-by-side results so you can sort of see how things changed. But one thing I'll note for you is that compared to when you ask people, which of these values is really important for my health versus which of these things are going to be affected by wildfire, sharing moved right up the bucket across all of the communities. And so that's something that came out as being really important to think about in the context of wildfires. But I'm curious, Colleen, if you have any interpretation or sort of your context for that.
Yeah, I think that the community really resonated with this when we shared out at the end, and maybe it's obvious, maybe it's not, but that if your food and your land and your family are affected by something like a catastrophic wildfire, your ability to share out will be impacted. Whether it's your sharing of your knowledge of your local lands, your traditional lands, or maybe it's sharing of actual food sources. That I think is why, and what the community really voiced as why their sharing would be impacted by a wildfire.
One other way we looked at these results, so Colleen mentioned that they used different colored dots so that we could track demographics and like who was giving us these responses. And so we could break down the responses by youth, elder, and then sort of everyone in between. And so I have 3 slides that sort of show these are the youth responses, and then I'll flip between youth, adult, and elder. So basically what you see here is on the left are all of their responses or their votes for that first question, which of these values impact your health? And then on the right-hand side are which of these values would be most impacted by fire. And when we were sort of flipping through these and sort of looking at differences across demographics, a couple of things jumped out. One of them was that spirituality is this dark green color. And so on youth, for the youth, you can see that in terms of where they felt that value lied and in terms of impacting their health, it was kind of one of the lower values. But if you look at the adults and elders, spirituality sort of ranked much higher in sort of their personal concept of what it means to be healthy, which I thought was an interesting observation for that you can get by breaking it down by different demographic groups. And one other thing to point out is that let's see, I think it was, oh yeah, sharing. You saw it in the ranked, sort of the overall ranked results, that sharing moved up in terms of the values what were most impacted by wildfire. Even when you break it down by demographics, so sharing is in orange. You can see that after a wildfire, it moved up in rank for youth, same for adults, and same for elders. So that was something that really resonated across age groups, even when when you broke it down by demographic. Okay. All right. Yeah, I'll send it back to Colleen for this one.
Sure. So I guess one of the most important values for us is that we're following advice and words from our elders and from our community, that no one's going off rogue, doing this stuff in a silo and not sharing it back. Data sovereignty means that it's findable and it's accessible and that everybody has access. And so with Micah and her team, we were able to bring back all of these results to our community. We held a really great community dinner where everybody was invited to look at these results, and we were able to talk about if they resonated with the community, if they made sense, if there was something that maybe didn't look right. And then we really got to talk about, hey, given this all of this information, how can we use it, and maybe what are the next steps that we might have moving forward. And it felt to me like a pretty powerful conversation because yeah, they really enjoyed the data that we shared. We maybe need to do better in the future about how we're going to share that back in terms of our model. You know, maybe the ribbon graph is not the greatest for elders. You know, maybe we need to keep it simple in the circle graphs or the bar graphs. So a lot of really good knowledge shared and gained at this. And then, yeah, I will just go ahead and talk about, yeah, this was open discussion. We got a lot of really great reflections. And yeah, there's the spoiler alert. We didn't love the complex graphs. Talking and sharing and visuals are the best ways that we learn in community. And actually, if we could go back just really quick, I did just want to share these data sovereignty principles of fair and care. That again, it's accessible to our community, that it's reusable and it can be replicated, and that there is a collective benefit. We didn't just do this project to have a report on a desk or just a project so that I can go out and write a grant. We did it so that everybody knows, and it is going to be available to everyone, and that any community that might want to do it can leverage this knowledge for funding or for their projects. Thanks, Micah. I think, oh yeah, so this also came out of the community meeting, is that food as an anchor to mental health, spiritual health was really important. And again, this is something that maybe we all know, but now we actually have like Western research and Western language to relay that. And so that our stories about salmon and community and sharing affecting our health is no longer looked at as anecdotal, that it's looked at as done as a proper research with a proper methodology, and that hopefully people can look at it with a lot more respect rather than thinking that stories are just stories. And I would just highlight some of the feedback that we got from Nellie Ewan, and I believe from her mom, Faye Ewan, is that it's not just health, it's once it's gone, it's gone. There is an urgency to protect a way of life, to protect a food source. And so doing this project with Micah and her colleagues is one step closer to putting up those walls and really safeguarding what is so important. And then Faye here on the right, saying sharing is not just giving, it's a way of showing care, which strengthens mental and spiritual well-being. And I think that really highlights why sharing moved up when we saw that something's happening. It's that we're showing respect by sharing with people who don't have. It's more than just giving people food, it's bonding, it's cultural ties, and it's tradition.
All right, so then sort of the end of the process, if you will, is, you know, they did a bunch of work identifying and ranking and thinking about which of these indicators are going to be impacted by wildfires and wildfire smoke. And then sort of the last part of the process is thinking about the application, like how are these indicators going to be used? And I mean, I was going to say, this is a really fun part of the process. The whole thing is really fun, but it's actually and this is kind of where we are now, actually. So maybe that's why I'm jazzed about it. But it's really exciting to think about sort of the myriad of applications that these indicators can have. You know, I have sort of already mentioned that, you know, if you are focusing on these health indicators, it gives you the ability to sort of create public health programs that address these things, but also you can do so in language that makes sense to funders. So for example, if you're applying for health promotion funding for chronic health, like maybe you don't want to focus on COPD or you don't want to focus on diabetes, you want to focus on sharing. Like this gives you sort of that framework to be able to justify that to external funders and be able to open up like a whole other world of potential funding. We talked a little bit about advocacy and sort of like, again, I think Colleen's, the way you said it sort of raises anecdote into like quantifiable metrics that sort of resonate at that same level can be really important for advocacy. And then I think what we've mostly been talking about with Copper River is thinking about applying it to adaptation strategies. And so if you, I'll let you, whatever you're comfortable with sharing, Colleen, in terms of the things that we've been talking about, and how we might want to apply it in Copper River.
Yeah, I'll just echo what Micah said, that having this information in a Western scientific format really allows us to leverage it and use it for funding. Funders seem to like nothing better than a really great annotated bibliography and resources and publications, and like Western knowledge to support what we're saying. So definitely going to be using our facts and statistics, pulling those out to write grants for the future. We also really want this to be available maybe for regional advisory committees, or other people dealing with subsistence issues. We know that the salmon are more or less gone from the Yukon and the Kuskokwim, and they have now, the Chinook salmon has now started to crash on the Copper River. And again, this is just a way that we can all kind of tie that together, and it can be used beyond the Copper River to advocate for rights and effect on health from loss of the salmon or caribou or what have you. And then, yeah, so that's kind of the political and the advocacy. And then we're really excited about applying kind of for this next portion. I think we're kind of in the beginning stages of talking about bringing back cultural burning in our region. We know that wildfire is huge. We know that we're already deeply affected by poor air quality. And we also know, based on cask models and all of these great tools that the Adaptation Science Center has given us, that our area is incredibly flammable, that we're likely to have a catastrophic fire at any point. And so to bring back fire to the land and really tie ourselves back to that traditional method of control and stewardship is going to be important for us moving forward. So maybe I'll just pause there. Oh,
I am muted. Okay. I think this is where we're going to end our presentation portion. So start thinking of your questions so that we can chat for a few minutes at the end. But we were kind of thinking a little bit about, why I think we feel like as a project team, this went well. And so we were like, so why did that go well? Like what, of course, I'm like, well, it's a solid methodology, whatever. Like what we were just kind of reflecting on why the approach seemed to resonate, I think, with both, Derrick and Lishaw, the folks that were involved in the data collection, but also Kelly can probably speak to like the conversations they were having in communities. Like you probably didn't have to try very hard to sort of convey this. Like we're probably trying a lot harder to convey what we mean. Whereas when she was talking with community members, my sense was like people kind of got it very easily. And so I'll break it down from like an academic, like here are the 3 things that we thought went well, and then Colleen can maybe reflect a little bit on her experience of it. We really tried to have a collaborative study design. Like as I hope was obvious, like I and my team were not the ones doing the data collection. Like it was something that was really led, both the design and the data collection was led by folks in the Copper River region. And actually, you know what? I'm gonna stop. I really want to call in to take this one because I think yeah, there is something I want to throw it to you. So I'll just gonna let you pick up from here.
okay.
If that's okay.
Sure, absolutely.
Okay.
Yeah, so I think like really talking with Lishaw and Derrick in our community, we felt like this was a really healthy approach to research. We've got researchers knocking on our door all the time from various universities, always looking to extract information, looking to better their careers, update, their resumes, what have you. And this relationship with Micah and her team felt really organic. I think that, co-production of knowledge and data sovereignty is really about enabling tribes and enabling our community members to do the work themselves. It's not Micah saying, do this, go out and collect that. It's Lishaw and Derrick and I brainstorming with guidance, from a PhD trained researcher on how we can make this happen for us, by us. And I think that's the most important piece that I would really reflect on, is that somebody else didn't do it for us. That, yeah, we were guided through the process, but we were the boots on the ground, collecting the data, bringing the information back to the community, et cetera, et cetera. And I would also just say that, what happened organically again in this relationship is that we turned a Western approach where, and this was maybe not the intent, but the Western approach of science and research where we're looking for results, we're going to build a thing, into a relationship building experience where Micah and her team really allotted time in their grant timescale to understand each other, to understand what our perspectives and our needs were, and to grow that. And that it basically turned into increasing our tribal capacity where we're all better understanding the situation. And now we've got this great relationship moving forward, where we don't feel exploited, we don't feel abused, we feel supported and facilitated, to learn more about our own region and then to really help connect with a larger audience, who may want to replicate this information, who may leverage or use this process and this knowledge for their benefit moving forward. And I'll stop there.
Yeah, thank you, Colleen. That was really helpful, and it made more sense coming from your end of things. So yeah, I think that's the end of our slide deck. So maybe we can turn to the sort of like open forum question and answer portion. I will just maybe throw out one question for you guys is, we were literally just having a conversation yesterday about, next steps in the Copper River region and also thinking about how else to sort of share this with folks in Alaska. And we had talked about the possibility of creating some kind of like asynchronous training or online tool or something to be able so that other communities could sort of walk through this process or like, see the example and think about how they might want to apply it in their own communities. And so I'd be very curious if that seems useful to people, if someone was like, yeah, I would totally do that, or if any ideas that come to mind, if that existed, would that be something that would be useful for you? Okay, so yeah, we'll stop talking and see what you guys have to say.
Well, thank you, Micah and Colleen, for that great presentation. There was so much in there, and yeah, I appreciated the stories and also really walking through the specific tools and just how you went through that. With that, I wonder if you could both put your contact information in the chat, just so that if there are folks who would like to reach out to you really regarding your last question, that they could go ahead and do that. And I guess with that, I would welcome the audience to go ahead and raise your hand or unmute yourself if you have any comments or questions for Colleen or Micah. I also would go ahead and invite you to put any comments or questions in the chat. And I might just wait a minute or two. I have a question, but I want to just make sure that our audience has a chance to go first. A quiet crew this morning. Well, just keep your thinking hats on, but I do have a question for you, Colleen. And a lot of the presentation focused on highlighting Ahtna values. But you made a comment that you have to have the right glasses or lenses on to know what those values mean. I just wonder if you might be willing to share either a story or an example of the values of respect and knowledge. Like what sort of encapsulates and I'm sure I don't want you to oversimplify that, but just kind of for the sake of our audience, like if there's an example or story you think that does a good job embodying those values.
Yeah, thanks, Krista. I'm very visual, so for me, when we showed that slide with all of our kind of regional kiddos and exchange of knowledge, um, that's where I see the values most. When we're sitting with Micah and the team originally, and I have on my Western trained healthcare glasses, I'm thinking like, how does respect make me healthy? Well, if I have respect for the environment that I live in, I'm not going to throw trash on the ground. I'm not going to burn it down if I can help it. I'm going to understand that it is brutal out there in interior Alaska and that I am not above all of it. If I have respect for my food, I will not waste. I will not waste, a huge fillet of salmon because it has, one little worm in it, or I will not let that food on my plate just go straight into the garbage. If I have respect for my family and my elders, when they tell me to practice a certain way or to act and behave a certain way, I will listen. I will know that I am not above all of it. I would say in terms of knowledge, and I'm looking at those pictures of those kids, there was the one, I don't know if you guys remember, where the girl's holding up a fish print of a salmon. She is, 16 years old. And that day in our class, that was the first time she had knowledge of a salmon. She had never put hands on a fish before. And so does that make her healthy? Absolutely. Knowledge of her tradition, knowledge of something that's woven into her DNA, is a great measurement of health. And really, that becomes knowledge of herself as well. And so is that a value that makes you healthy? If you know yourself to the core, you know your identity, you know your culture, you know your value. I really think that that's how we tied and put those new glasses on, and we're looking at these kids and we're saying, that is what makes a healthy human, really knowing yourself and knowing your environment and your traditions. And without that, can you truly be healthy if you don't know where you come from and what you stand for and where you are? I think that's kind of how, when we put on those glasses, we're looking at people. It's not her blood pressure. It's that smile on her face, and that traditional piece of knowledge that she's holding up that made her so bright and shiny. So I hope that answers your question.
Yes, thank you. That was wonderful, Colleen. And thank you, Michelle, for your comment in the chat. Looks like you and Micah have connected there, so that's great. Yeah, I might just invite anyone to add any questions or comments before we hop off. Just as a reminder, this session is being recorded, and so we should have it available on our website within the next week. So if you want to go back and review any of the content that was shared today, or share this presentation with anyone else, we'll have that link available. So thank you. And we're getting lots of thanks in the comments here. And though it doesn't look like any questions. So I think with that, we will go ahead and wrap up today's session. Thank you so much, both Colleen and Micah.
Thanks for having us, Krista. That was fun.
This is great.
Mhm.
Thank you so much.
Bye, everyone. Have a good afternoon.
Bye.
Yeah.